Endotracheal intubation is a critical medical procedure. It involves inserting a tube through the mouth or nose into the trachea. This tube ensures an open airway and allows for mechanical ventilation. The procedure is often life-saving and is used in emergency situations and during surgeries. The main goal is to maintain proper oxygenation and help remove carbon dioxide from the body. This is crucial for patients who can't breathe on their own. The tube bypasses obstructions in the upper airway and provides a direct route to the lungs. Doctors use special tools to perform intubation. These include a laryngoscope to visualize the vocal cords. The procedure requires skill and precision. It's typically done by anesthesiologists or emergency physicians, but nurses and paramedics may also be trained to intubate. Intubation is not without risks. These can include damage to teeth or soft tissues, and there's also a risk of introducing infections. However, when needed, the benefits far outweigh the risks. It's a vital tool in critical care medicine. Understanding when and why it's used is crucial for healthcare providers and patients alike. Oxygen and carbon dioxide levels in the blood are crucial indicators. They help determine the need for intubation. Low oxygen levels, known as hypoxemia, can be life-threatening. High carbon dioxide levels or hypercapnia are equally dangerous. Both conditions can lead to organ failure if not addressed promptly. Doctors use various tests to measure these levels. Pulse oximetry provides a quick, non-invasive way to check oxygen saturation. Arterial blood gas analysis gives more detailed information. It shows both oxygen and carbon dioxide levels. These tests help guide treatment decisions. Specific thresholds often trigger the decision to intubate. For instance, oxygen saturation below 90% despite supplemental oxygen is concerning. A partial pressure of carbon dioxide above 50 millimeters of mercury may also indicate the need for intubation. However, these numbers aren't absolute. They're guidelines that doctors interpret in context. Other factors also play a role in the decision. These include the patient's overall condition and the cause of respiratory distress. Sometimes non-invasive ventilation methods are tried first, like CPAP or BiPAP machines. If these fail to improve oxygenation, intubation becomes necessary. The goal is always to ensure adequate oxygen delivery to vital organs. Neuromuscular disorders can also necessitate intubation. Conditions like Guillain-Barré syndrome or myasthenia gravis can weaken respiratory muscles, making it difficult for patients to breathe on their own. Intubation and mechanical ventilation support these patients, giving time for treatment to take effect or for the condition to improve. Section 4. Intubation in surgical procedures. Many surgical procedures require endotracheal intubation. This is especially true for operations involving general anesthesia. Dr. Martinez, intubation ensures a secure airway during surgery. It allows for controlled ventilation, which is crucial when patients are unable to breathe on their own due to anesthesia. Nurse Kim intubation during surgery serves multiple purposes. It protects the airway from aspiration, which is important as patients can't swallow or cough while under anesthesia. It also allows for precise control of oxygen and anesthetic gas delivery, helping to maintain optimal conditions for surgery. Dr. Martinez, some surgeries specifically require airway manipulation. Procedures on the head, neck or chest often fall into this category. Intubation provides clear access to these areas and keeps the airway secure while surgeons work nearby. This is crucial for patient safety during these complex operations. Nurse Kim post-operative care may also involve continued intubation. Some patients need ventilatory support after surgery. This could be due to the effects of anesthesia or the nature of the surgery. Intubation allows for this support until the patient can breathe independently. The decision to extubate is made carefully, ensuring the patient's safety. Section 5. Newborns and the need for intubation. Newborns sometimes require intubation immediately after birth. This is often due to respiratory distress syndrome or RDS. RDS is common in premature babies. Their lungs aren't fully developed and they struggle to breathe on their own. Dr. Patel intubation allows for surfactant replacement therapy. This helps the tiny air sacs in their lungs stay open. Congenital abnormalities can also necessitate intubation in newborns. Conditions like tracheoesophageal fistula or diaphragmatic hernia affect breathing. Intubation is crucial in managing these conditions, ensuring proper oxygenation while preparing for corrective surgery. Patient's parent meconium aspiration syndrome is another condition requiring prompt intubation. This occurs when a newborn inhales meconium-stained amniotic fluid, causing severe respiratory distress. Intubation allows for suctioning of the airways and provides respiratory support until the condition improves. Dr. Patel, some newborns with severe infections may need intubation. Sepsis can lead to respiratory failure. Intubation and mechanical ventilation support these tiny patients, giving their bodies time to fight the infection. The decision to intubate a newborn is never taken lightly. It's based on careful assessment of the baby's condition and needs. Section 6. The importance of clinical context. While guidelines exist for intubation, clinical context is crucial. Every patient is unique, and their specific situation must be considered. Dr. Martinez, doctors don't rely solely on numbers. They look at the overall clinical picture, including the patient's history, physical exam, and response to other treatments. Nurse Kim. Sometimes a patient might meet numerical criteria for intubation, but they might be improving with other interventions. In such cases, doctors might hold off on intubation and continue to monitor the patient closely. Dr. Martinez. The goal is always to provide the best care while avoiding unnecessary procedures. On the other hand, some patients might need intubation before reaching standard thresholds. This could be due to rapid deterioration or anticipated complications. Dr. Patel. Experienced clinicians use their judgment in these situations. They act proactively to ensure patient safety. Understanding the importance of clinical context is vital for healthcare providers. It's also important for patients and families to grasp this concept. It explains why medical decisions can vary between seemingly similar cases. This approach ensures each patient receives personalized care, balancing guidelines with individual needs. In the end, the goal is always to provide the best possible outcome for each patient.